Welcome to Health After 50. Today we're going to talk about dementia, and before you click away thinking this is going to be a scary topic, let me tell you this: did you know that dementia affects more people than cancer and heart disease combined? That's right, it's a pretty big deal and affects a lot of people. So whether you're a caregiver, a loved one, or just someone curious about the topic, keep watching because we're going to make this informative, and hopefully, a little less daunting. First, let's talk about the symptoms. Dementia is characterized by a decline in cognitive abilities, such as memory, thinking, and reasoning. Some of the early signs include forgetfulness, difficulty completing familiar tasks, confusion about time and place, and problems with language. As the condition progresses, people with dementia may have difficulty with daily activities, such as bathing and dressing, and may become more withdrawn and isolated. It's important to note that this is not a normal part of aging, and there are many types of dementia with different causes and symptoms. Some types, such as Alzheimer's disease, can be diagnosed with a certain level of certainty, but others, such as frontotemporal dementia, can be more difficult to diagnose. The causes of dementia are involved and not fully understood. However, some of the known risk factors include age, genetics, and lifestyle factors such as smoking and heavy alcohol use. Certain medical conditions, such as high blood pressure and diabetes, also increase the risk of developing dementia. Research has also shown that factors such as education, social engagement, and physical activity may also have an impact on cognitive decline and its development. While there is currently no cure, there are treatment options that can help manage the symptoms and improve quality of life for people with dementia and their caregivers. These include medications, such as cholinesterase inhibitors, which can help improve memory and thinking, and memantine, which can help with some of the behavioral symptoms. Therapies such as occupational therapy, speech therapy, and physical therapy can also be helpful. They can help people maintain their independence and improve their ability to carry out daily activities. It's also important to note that there are many non-pharmacological interventions such as cognitive stimulation therapy and physical exercise that have been shown to be effective in slowing down cognitive decline in people with dementia. In addition, support and education for caregivers and family members can be incredibly important. Caregivers may need help managing the emotional and physical demands of caring for someone, and support groups can provide a valuable source of information and emotional support. So, how can you best support a loved one? One of the most important things is to be patient and understanding. People with dementia may have difficulty communicating, and may become frustrated or confused. It's important to speak clearly, use simple language, and provide plenty of time for the person to respond. Another helpful strategy is to use visual cues, such as pictures or diagrams, to help the person understand what you're saying. This can also be useful when giving directions or instructions. It's important to maintain a consistent routine and familiar environment for a person with dementia. This can help reduce confusion and agitation, and may make the person feel more secure. It's also important to be aware of the emotional and psychological needs of the person. People with dementia may experience feelings of isolation, depression, and anxiety. Encourage the person to participate in activities that they enjoy, and provide opportunities for social interaction. The bottom line: dementia is a serious condition that affects millions of people around the world. While there is currently no cure for it, there are treatment options and strategies available to help manage the symptoms and improve quality of life for people and their caregivers. It's important to seek medical advice and support as soon as possible if you or a loved one is experiencing symptoms. Early diagnosis can help people to access appropriate treatment and support.